So in this video, I'm gonna show how to set up an IV piggy bag. For today's infusion, I'm gonna be using cefazolin as my secondary, and then I'm gonna be using 0.9 normal saline as my primary. Prior to setting up anything, I'm gonna make sure that my medications are compatible and make sure there's no interactions. After doing my first and second check at the Pyxis and the medication room, I'm gonna go ahead and do my third medication check at the patient bedside. Prior to doing that, I'm gonna confirm patient identity with name and date of birth, as well as any allergies to ensure that they're not allergic to any component in my medication. After doing so, I'm just gonna go ahead and check the IV site for any infiltration, any swelling, or any fluid leaking out. Basically any signs that indicate we can't use or we can't set up our infusion. But in this case, everything looks good, so we'll continue. For cefazolin, this is an antibiotic. I would do my pre-assessment such as labs, namely WBC. I would also take a full set of vitals, especially temperature, heart rate, blood pressure, and respirations, as well as O2. Once I have done that, I am going to go ahead and proceed with my infusion. So I'm going to go ahead and grab my secondary tubing in order to spike my bag. I'm going to go ahead and make sure my line is clamped, and then I'm going to go ahead and spike that. Once I hang that, I'm going to make sure my chamber is filled 1/3 to halfway, and then I'm going to go ahead and slowly unclamp in order to prime my line. Once I see that first drop, I'm going to go ahead and clamp again and go ahead and put that to the side. Having done that, I'm going to go ahead and pause my primary infusion. Okay, once that is paused, I'm going to go ahead and hang my primary fluids as they do have to be lower than my secondary. Okay, and having done that, I'm going to go ahead and set up my pump. Okay, I'm going to pick secondary. I'm going to go scroll down and look for my meds, so cefazolin. My order calls for 2,000 milligrams going at 100 mLs an hour. Luckily, that is already preset in our pump, so I'm going to go ahead and select that. It's just asking me to confirm. Confirm that again. And I'm going to go ahead and fix my rate, which will be 100 mLs over 1 hour. Once that is done and I confirm it, I'm going to go ahead and start my infusion. Oh, sorry, actually, before I do that, I'm going to go ahead and swab my port, as I do have to connect my infusion first. Okay, so grabbing my port on my primary tubing, I'm going to go ahead and swab for 15 seconds. Once I have done that, I'm going to go ahead and connect them. Now I will resume where we left off. I'm going to go ahead and unclamp my line and resume that. Okay, making sure I see my first drop. Okay, and now I'm just going to label my medication and my tubing. I'm going to label that with my initials, the medication, the rate, as well as the date and the time. And then I'm also going to label my tubing with my initials, the date and time, and when this can be changed, which is going to be in 96 hours. And I would like to mention that my bag is also going to be good for 24 hours. Once that is labeled and my infusion is running, I'm going to go ahead and chart my medication administration, perform hand hygiene, and reassess my patient in a couple of minutes.